Zika was a little-known virus named after the forest where it was first discovered in monkeys in 1947. Its carrier, the Aedes aegypti mosquito, wasn't known to travel very far. But in 2015, Brazil sounded the alarm. Zika had made its way to South America and was spreading fast. And most shocking, its effect on pregnant women who gave birth to babies with microcephaly, a mutation that causes an abnormally small head.
To have a tenfold increase in numbers, we believe is a matter of public health concern and constitutes an international emergency.
With the Rio Olympic Games around the corner, there was panic.
The big fear is that they're going to go home with more than souvenirs. This is already a pandemic. It's spreading very rapidly.
Zika is now a global epidemic. The most recent infections have been found in Southeast Asia. It's also rare. Only 1 in 4 people develop symptoms, and they're usually mild. Experts have also confirmed that sexual transmission is possible. Since last year, the spread of Zika has slowed in countries like Brazil and Colombia. But in places like Puerto Rico, the number of cases is rising. The Aedes mosquito has become more numerous. It's also evolved to live closer to humans and is now spreading other diseases.
The spread of Zika, the resurgence of dengue, and the emergent threat of chikungunya are the price being paid for a massive policy failure that dropped the ball on mosquito control in the 1970s.
Scientists think they have a solution. Genetically modifying sterile mosquitoes and releasing them can reduce populations by 90%. But there's still no vaccine, and there's no cure for the thousands of babies suffering from microcephaly. Doctors recently discovered that Zika can cause other health problems.
Complications with the eyes, with swallowing. We're seeing babies born with stiff limbs and having seizures. So we know now that this is encompassing something that we call congenital Zika syndrome.
Another side effect has been a heated debate in Brazil about access to abortion, which is illegal. The new conservative Congress has proposed laws to increase jail time for women who abort fetuses with microcephaly. One rights group has launched a legal challenge before Brazil's Supreme Court.
When it comes to Zika, we are talking about an epidemic of mental suffering imposed on women. Because of the uncertainty that comes with going ahead with a pregnancy, brings unknown consequences.
The media coverage might have subsided, but certainly the activity and the transmission is not gone. So Zika is certainly still here, and I think it's going to be quite some time before we really see a true interruption of Zika, if ever.